Again, I'm Matthew Nossi from Chicago Spine and Joint Care. It's a chiropractic clinic. I'm a chiropractic physician. Our clinic's about 2 blocks from here. We combined chiropractic care with nutrition, which is one of the presentations we're going to be doing, along with medical massage therapy and rehabilitation. So we like to look at health as a whole rather than treat one particular thing, but really we're treating a lot of low back pain, neck pain, joint injuries, chronic pain, a lot of headaches, stuff like that, but we treat it in many different ways. Go ahead. So we got two presentations that we're going to do. First one's nutrition and health, and then nutrition as it relates to health, and the second one's going to be work biomechanics, and specifically because you guys are in an office setting, we're going to be talking about office biomechanics, so it's not going to be a lot of talking about lifting or doing a lot of manual labor. It's going to be sitting at the desk working the computer and that type of stuff, which can lead to pain and lead to problems and lead to health problems as well. So we're going to talk about that after, and then we're going to have a little bit of a demonstration at the end, hopefully, if we have time. I think we will. I'm going to give you a couple handouts. These are going to be some of the exercises that we demonstrate. If you can just pass them back, actually, it'd be easier. Should be enough. I'll leave them here in case there's not enough. So hopefully we'll get to demo a little bit of this stuff at the end. Nutrition and work biomechanics are something I have particular interest in. One, we do it a lot at our clinic, but also because it's a part of healthcare called proactive healthcare. So really there's 2 ways you can look at healthcare. One is reactive healthcare, which is what most people think of when they think of the healthcare system. It's wait till you're sick, wait till you get sick, or wait until you're injured, or wait till something goes wrong, and then you go in and get whatever that is fixed, whether it be taking medication, surgery, therapy, a hospitalization, whatever you're trying to fix the condition. Proactive healthcare, which encompasses nutrition, biomechanics, regular dental checkups, physicals, blood glucose screenings, blood pressure screenings, all that type of stuff. Anytime where you're trying to catch a disease early or prevent a disease from happening, that's proactive healthcare. Really, that's the way that healthcare in the future is going to have to go. It's really unsustainable as treating a disease. So this is what I'm really big in and really kind of profess. So these 2 lectures will give you a little bit of insight as far as that goes. The first one we'll start with is nutrition and health, and we'll just talk about first why it's even important to worry about your nutrition, why proper nutrition is important, and really it affects everything about your life. Energy level, weight, it'll affect your lifespan, memory, disease prevalence. Really the big one on here is going to be the weight issue. The obesity, gaining weight, directly correlates to a lot of preventable disease. The other one's energy level, memory, your mood, depression, anxiety, all that type of stuff can be affected by nutrition just because of the nutrient level that you're getting. If you're not getting the right amount of nutrients, memory, energy level, all that kind of stuff can be off as well. But really the big one is going to be weight. So that's what we're going to talk about first. This is an obesity diagram of the United States from the Centers of Disease Control, and this is as far back as 1994. So really it's going state by state, and it's talking about what percentage of the population of each state is in the obese category. Obese is defined technically or medically as a BMI over 30%, body mass index. Body mass index is one tool that's used to help determine if somebody's at risk for some of these diseases, the obesity-related diseases. It's a tool. It's not all-encompassing. It needs to be taken into consideration with things like weight and fat percentage. What's that?
Is all that accurate, though?
They're tools. Body mass index can be skewed by if you're shorter.
When I was in college and I was a football player, I was considered obese based upon that index.
Because you had a bigger body mass, but not a large percentage of fat. Bodybuilders are often considered obese for the same reason, probably.
Yeah. 6'2", 225,
but
punching 320.
But muscle, but yeah, mostly muscle. Right. So you would be. Yeah, right. So a lot of that kind of football players, bodybuilders are notorious for it, of being obese, even though they're not at risk for any of these obesity-related diseases. And that being said, the map of the United States, 1994, 15 years ago, yeah, The lightest light blue here is under 10%. Nowhere in the country is the population under 10% obese. The next one up, the lighter light blue, most of the country fits into this one, 10 to 14%. The darker blue, most of the Midwest is notoriously known, and most of the South as being the more obese parts of the country. But nowhere in the country, as far back as 1994, do we have up to 25% obesity rate. Anybody have a guess of what's going to happen when I change the slide?
It's going to be totally different.
It's going to go up just a little bit. So again, Midwest, up to 25% obesity, and this is in 2000. Same statistic from the Center of Disease Control. The rest of the country has pretty much caught up to what the Midwest was in 1994, up to 20% obesity. Next one, we got one more slide. Up or down, you think?
Up.
Up. So basically what this one is telling us, and this is 2008, so this is the most recent one they've done as far as I know. Most of the country is now over 25% obese, which again, we'll talk about in the next slide, leads to a lot of diseases that not only individual will have to deal with, but the nation as a whole needs to get a kind of a grip on this. And you can see the last little box, over 30%. We have 6 states that are over 30% obese by population now. So what this chart is telling us is that we need to make more boxes. There's going to have to be a 30 to 35 box in the next one. There's going to have to be up to 50. Who knows? But this is something that, again, isn't sustainable. This has to be reversed, or this will potentially collapse healthcare by itself. For whatever reason, Colorado is the most healthy state and has been since they started keeping the statistics. So,
you know why Colorado is much more healthy?
Let's hear it.
The things there are few and far between. And you see people in Colorado, they're biking, they're jogging.
Oh yeah.
And you go through the mountains, you see people riding up the mountain on a bike.
Right.
And we're talking a steep mountain. I've been to Colorado many times,
Yeah.
and that's why those people are thin.
Well,
Everyone out there is walking.
we need more. We
Everyone.
need things to be spread out, or more mountains than in the country. I don't know. So now we're going to talk a little bit about, that's what's happening. That's the trend in the country. But now, why does that matter? 10% of healthcare spending is spent directly on obesity, and that's spent on things like high blood pressure, diabetes, arthritis, all kinds of cardiovascular problems, all of the diseases that are typically related to obesity. Obese individuals themselves spend 42% more per year on their health care than the average population, or what we would hope the average population would be. The problem with this is that most of that is spent on prescription drugs that are trying to treat the diseases that are related to the obesity, not the obesity itself, which is the underlying root cause. So obese individuals are spending money to treat the disease, but not really fixing the problem. That's great for drug company profits. That's not great for the country as a whole or the individual. So really there's 2 costs to this. One is to the individual's health, and one is to the healthcare system and the financial system of the country and the individual as a whole. Those are some of the related diseases. High blood pressure is the obvious one, diabetes, stroke, all the cardiovascular, but then there's also arthritis. As you load the joints with more weight, they break down faster. Depression's correlated. Again, a lot of mood disorders are correlated with obesity and poor nutrition in general.